I'm Max Davie. In my day job, I'm a community paediatrician in Lambeth, London's greatest and most angry borough. But I'm also essentially mental health officer for the Royal College. So I'm sort of responsible for a slightly vaguely defined role about training and policy around mental health, which essentially means a lot of meetings and a lot of documents and some thinking and talking, which is good because that's what I like. The first thing to say about mental health, and we could do an hour on the definition of mental health, which fortunately I've been given 10 minutes. And I'm not going to talk about the definition of mental health. If you read the papers, and obviously like everyone else, I'm delighted that we have such high profile people coming forward to talk about having had problems with their mental health. But they all talk about this. They all talk about anxiety and depression. Sometimes there's discussion of self-harm. Interestingly, self-harm is very common. I've given a kind of, in this diagram, is a kind of vague scaling of how much of a problem this is. So there's obviously overlap between the two. We see in hospital a tiny proportion of mental health, a tiny proportion of self-harm. That's worth bearing in mind.